Hello, my name is Dr. Andy Wolf, and today I want to answer some important questions about colorectal cancer, or colon cancer for short, which is cancer of the lower part of the intestine called the colon and rectum. First, I want to dispel a common myth. Many people think they are safe from colon cancer if they aren't having any symptoms like stomach pain or problems with their bowel movements. But the fact is, most people with colon cancer don't have any symptoms at all until very late. So how common is colon cancer? It's actually quite common. The average American has about a 1 in 25 chance of being diagnosed with colon cancer at some point during their lifetime, making it the #2 cause of cancer and the #2 cause of cancer death among cancers affecting both men and women, behind lung cancer. Who's most at risk for colon cancer? It's important to know that anyone can get colon cancer, and most people who get it have no known risk factors. But the most important risk factor is having a family member who has had colon cancer, especially if diagnosed at an early age. If colon cancer is caught, is it curable? The answer depends on when it is caught. If caught early through screening, before symptoms develop, it is almost always completely curable. If caught after symptoms have developed, it has often already started spreading to other parts of the body. While it is still treatable at these stages, the chance of cure is much lower, and the treatments, such as radiation and chemotherapy, are much more difficult to handle. What screening options are available to patients? The most common screening tests are colonoscopy and stool tests. Colonoscopy is a flexible tube with a camera on it that allows the doctor to examine the entire colon and detect cancer. It also allows the doctor to detect and remove precancerous growths called polyps. You are given a sedative before the colonoscopy, so you're unlikely to feel significant discomfort during the procedure. Stool tests involve providing a small stool sample that is examined for tiny amounts of blood not visible to the naked eye, or microscopic cancer particles. There's also a type of CAT scan called the CT colonography or virtual colonoscopy that can detect cancer and large polyps. Which test is best? That really depends on you, the patient. Colonoscopy may be best if you want the chance to find and remove precancerous polyps and don't mind taking a day off from work and taking a powerful laxative to clean out your bowels for the test. Stool testing may be best if you want a quick, convenient test that you can do at home. At what age should you begin screening? The American Cancer Society now recommends that people start screening at age 45. If you have a family member with colon cancer, it's recommended to start screening with colonoscopy 10 years before the age when they were diagnosed, or age 45, whichever is earlier. Are people delaying screening because of COVID? Yes. A lot of people are delaying a lot of their care because of COVID, but it's not necessary, nor is it a good idea to delay screening. Cancer is not waiting for COVID to go away, and neither should you. Colonoscopies are being done safely, and if you don't want a colonoscopy, you can do stool testing in the safety and convenience of your own home. Should patients talk to their insurance provider before getting screened? Almost all insurances now cover some type of colon cancer screening, but it's always a good idea to check first to see what the cost to you will be. If someone is interested in colorectal cancer screening, who should they talk to? You should definitely talk with your primary care physician, who can review with you the testing options and help you pick the screening test that is best for you.